So let's have a look at an abscess. And the important thing to understand about an abscess is that physiologically, it's a fundamentally different process to a glioblastoma or a metastasis, where the enhancement is the pathology in the latter two. Whereas in an abscess, the enhancement are the elves. That's your brain trying to keep the pus contained. And so it's a physiological, organised response all the way around the invading horde. And that pattern is what helps you to distinguish abscesses from the other two entities on the grounds of enhancement. So let's have a look at an abscess. So we have a complete sphere of enhancement that when you look at cross-sectionally will appear to be a ring. And on the middle slices, where you're not getting much partial voluming, it's really quite regular. It'll usually be a bit thicker towards the cortex, where there's more blood supply, a little bit thinner towards the ventricle, and eventually it'll point to the ventricle and discharge into the ventricle, and you get rip-roaring ventriculitis, and the patient will die, usually very quickly. So you preferably make the diagnosis and treat it before that happens. The other thing to note is that it also has a bit of a fuzzy margin. And it's kind of interesting that the fuzzy margin of lymphoma that's created by lots of white cells to be within the brain is the same as the fuzzy margin around an abscess, which is created by lots of white cells within the brain. And these are migrating towards that edge. It's not a perfect, sharp line. It's slightly hairy. The term hairy is used, which is kind of weird, but I think gets the point across. You might get some little pockets of additional pus that sort of get walled off. And when you look at T2 weighted imaging, superimposed on the enhancing margin is a complete T2 low ring. And this is due to cytokines and free radicals released by all those monocytes in that defending border. And you can see it on SWE as well, susceptibility weighted imaging. It's very uniform. There might be tiny little areas of irregularity, but it's a complete line, not little segments, not just blotches. Again, because this is a organised physiological response, so you're expecting the process and the appearance of it to be stereotyped all the way around. We all know and love diffusion restriction, low on ADC, lots of vasogenic edema around it, because the blood-brain barrier in that area of inflammation is broken down because of all those cytokines. So ring enhancement of the other two, very different process. When metastases or glioblastomas become ring enhancing, it's an osmotic phenomenon. They start off as little lumps, something happens internally, a bit of necrosis or cyst formation, and there's an osmotic gradient that draws more and more fluid into it, and it expands just like a balloon. And so you have this very, very thin, regular, stretched out tumour around the margins. Same on both. There's no hairiness here, okay? DWI, of course, is different. Pus will show diffusion restriction. And if there's no hemorrhage, and if the goop is not too proteinaceous, then there's no diffusion restriction. So if you see a ring-enhancing lesion that has no diffusion restriction centrally, you can be very certain that it's not pus. If you see a ring-enhancing lesion with diffusion restriction, you have to raise abscess, but be aware that a hemorrhagic lesion, or one that's got really thick proteinaceous necrotic goop in it, might diffusion restrict. And you have to be willing to be wrong once in a while. Usually the surgeons who haven't told you any of this information, but have seen the patient and know the patient's history, have a fairly good idea of whether it's likely to be an abscess or not. Maybe the patient's really well and has known metastatic disease, which they haven't bothered to tell you. And that means if you say it's an abscess, they won't believe you and they won't treat it. The worst thing you can do is push the surgeons away from something that is an abscess that then ruptures into the ventricle while you're waiting for someone else to have another look at it. Okay? You'd rather them drain a met than not drain an abscess.